Well, in this week's Cardiology Countdown, we'll talk about the hazard of living alone, comparative diabetic treatments, and a possible new treatment for pulmonary hypertension. Begin with the study looking at the hazard of living alone was recently published in the Annals, coming from an interesting source, an eye exam with 5- and 10-year follow-up. And it had been previously reported by a fellow and Deepak Bhatt here from the REACH registry that living alone appeared to be associated with increased risk of dying in cardiovascular events. And so this study looked at this with 10-year follow-up and found that in people who were less than age 75, there was about a 38% higher risk of death after multivariate adjustment. In patients older than 75 years of age, there did not appear to be a hazard of living alone. And an interesting study, I think other groups will look at this, but does speak to the benefits of social support in carrying out health behaviors and hopefully then better mortality. The next study is the Duration 6 study. That was a comparative study of two different injectable glucagon-like peptide receptor antagonists, or GLP-1 receptor antagonists. It compared the once-a-week exenatide preparation with the once-daily liraglutide and looked at the glycosylated hemoglobin reduction with the two and side effects. Now, they found that the reduction in the hemoglobin A1C was 1.48% for the daily liraglutide, the control group, and slightly less than that, 1.28% for the once-a-week exenatide. In this comparison that titrated quickly to higher doses of liraglutide, the exenatide was better tolerated with lower rates of nausea, 9 versus 21%, favoring exenatide, and vomiting was 4 versus 11%. But the editorialists point out that this was a relatively aggressive strategy for use of liraglutide. So in the end, impressive reductions in hemoglobin A1C with the injectable agents and certainly very good data for the once-a-week preparation. And at the #1 pick this week is a study of a possible new treatment for pulmonary hypertension, an oral preparation of the prostacyclin analog treprostinil. This is an agent that's available intravenously, and patients with severe pulmonary hypertension have this effective therapy. This study carried out an oral preparation versus placebo in patients not on other treatments, and so in the early phase, and found a significant improvement in the 6-minute walk in terms of exercise tolerance. It was reasonably well tolerated for a class of drugs like this, but about 2/3 of patients complaining of headache, not surprisingly, with the vasodilator, and 39% with nausea and diarrhea. And so this opens the door to it being a possible oral treatment for early pulmonary hypertension. So for this week's Cardiology Countdown, I'm Chris Cannon.